Hello, founders. It's time for another pitch deck critique and review. And this time we have a deck from one of our subscribers, Luke. And this startup is called My Health. And this startup is trying to raise a pre seed of 250K. And this is a really interesting deck. I actually learned quite a bit. I was fascinated. But this deck is at about 50% because it is way too long and the information is disjointed. We need to create a cohesive narrative to tie all this deck together. I'm going to show you how to create a screener deck that is a deck that gets sent to investors so they want to have another meeting with you and see the rest of your pitch and presentation. Before we continue, as always, my name is Ed Kang, seven-time funded founder with 2 exits. That just means I failed a bunch of times for your benefit, and I like to use videos like this to help early stage founders, all founders really, but I love early stage founders, help you raise your pre-seed or seed round or get that initial traction so you can get that investment. In my day, I've raised over 9 figures of funding for my startups, other startups, and different funds and other ventures, and I want to help you do the exact same. If you're a founder and you have a pitch deck and you want it critiqued or reviewed, stick to the end of the video. I'll show you how to get that done. Let's jump into this one. First off, we're looking at the cover page. It says My Health Smartphone Eye Tracking, Seamless Digital Biomarker. This part right here, eye tracking, this was interesting right away, caught my attention. But this right here, I was like, what is that? Therefore, I want you to adjust this headline. I like the fact that you are just very straightforward. This provides smartphone eye tracking for what? To passively diagnose disease before it occurs. Something along those lines, because that's what you're getting into, passive tracking for prevention. Maybe you want to have smartphone eye tracking to passively track and prevent diseases before they occur. Something along those lines. I think that would be a good start. Here we are at the problem slide. And right away, we're running into some issues because you've got all these bullet points that are just disjointed. There's no cohesive narrative, and it takes too long for the investor to think through what exactly is the problem that we're solving. And then I'm going to show you how to create one cohesive narrative. So let's look at all these points here. Neurological disease, limited access, high cost. The problem, I want you to move this over here and just put the problem small in the upper left corner. That's going to just get that out of the way. So it's not competing with the information. There's no early detection of these diseases, and patients live undiagnosed for years, and there's no continuous monitoring of disease progression. Okay, so we need to get exact. When you're doing a problem statement, it makes much more impact when you explain the size and the severity of the problem so investors get it. Now, in this case, most likely your investors, well, especially me, you might have some people who understand they are not going to have the medical data to understand where you're going with this or how severe, impactful the problem is, how wide, and the fact that this is a very big TAM. And I know you've included numbers later on this deck, but we want to bring them up front. Something like 50 million people get Alzheimer's, Parkinson's, and multiple sclerosis every year that could easily be prevented with early detection. You see where I'm getting at? This is a huge problem. All these people are getting these diseases and there's no early detection, or there should be early detection, and these 50 million people are suffering because of it. Or you can push it a little bit further. You can say something like $1 billion a year is spent on Alzheimer's, Parkinson's, and multiple sclerosis that could be avoided or prevented if there was early detection. You see how I got to this is the high cost, the billions that are spent because we're treating all this after the fact, not immediately. So talk about how bad the cost is, and then talk about the fact that it's easily preventable. Here's another version. I hope you're taking notes. You could say something like, there are over 50 million people a year that live with undiagnosed Alzheimer's, Parkinson's, and multiple sclerosis that will cost the medical system $1 billion to treat, but could be easily prevented with monitoring and early detection or something along those lines. I hope you see what I'm getting to. I've taken all this information and I put it into one cohesive sentence. That's what you're looking for, because right now I'm not getting it. This headline up at the top tells me nothing. It just says neurological disease, limited access, high cost. So what? What does that actually mean? You are not posing a problem to the investor saying this is a problem that costs money, and if we solve it, whatever company does, it's going to be an amazing unicorn and we're going to make a lot of money in the meantime, because that's what investors are there for. I spent a lot on this problem statement, but It's that important that you get this right because this deck is very technical. This product is medical. Break it down like I'm in the 6th grade and explain to me. The simpler you get it, the easier it will be to get the investor on board. Here's a solution slide, and this is where the deck starts to get really muddled and starts to slow me down because there are multiple solution slides. I'm going to walk you through all these solution slides. I'm going to show you how to consolidate into one. You've got a solution slide here that says eye tracking, smartphone app, early detection, continuous monitoring. Again, 4 disjointed points that summarize where you're trying to go, but there's no cohesive narrative. And then you got this HLS7 FHIR graphic, and I have no idea what that means. So we're just going to eliminate that completely. I'm just going to say, just get rid of this stuff right here, and we don't need it. We just want to make sure that the investor knows that there's a solution that solves a problem that we looked at just one slide earlier. Here's the next solution slide. And Luke, I'm just going to let you know that I took the liberty of reorganizing your deck because you had slides in different spots all over the place and repeated in terms of the sections and different areas. And we just want to create a cohesive narrative that an investor can look through this in roughly 3 to 5 minutes and just get right to it and then want to call you or contact you so that they can talk to you further and say, hey, I want to get on this deal. Here's the solution slide. And this one actually is a little better than the previous slide because look what you got here. You've got eye tracking can detect subtle changes. There's a solution, visual behavior, early warning signs. And then you've got eye tracking for early detection of Alzheimer's disease is promising, supported by several studies. This is a little bit of a why now statement, but it's better at solving the problem because in the problem statement, we said that people live with undiagnosed Alzheimer's that could be easily prevented. And now we're saying eye tracking can actually solve the problem of diagnosing and preventing Alzheimer's disease. So let's go back to the solution slide here and let's combine these two, eye tracking and these bullet points right here. Let me go back to the principle here. The problem statement was that there are millions of people that are going to cost the healthcare system billions of dollars because they're undiagnosed, or if they just spent a little bit of time with early diagnosis, we could be preventing this. And here's their solution. So what do we say? We can say something to the effect of, My Health is a smartphone app that tracks your eyes for early detection and continuous monitoring of diseases like Alzheimer's and the other diseases that you've listed there for early prevention. Early detection, early prevention, something along those lines. Now I'm just riffing here. One more time. You want to say this is solution. What is it? It's a smartphone app that tracks the eyes. What does it do to solve the problem? It helps with early detection and continuous monitoring of undiagnosed Alzheimer's, multiple sclerosis, Parkinson's, all that stuff. And then you might want to add something like for prevention, which is a fraction of the cost of treatment after diagnosis, saving healthcare patients millions of dollars a year. So you see how the solution was the inverse of the problem statement and solve the problem step by step, but in a very straightforward fashion of saying what this solution is, what it does, and why it's so important, and how much money you're going to save and eventually the investor is going to make. I move this global market opportunity up because typically the market opportunity goes after the problem solution statement, sometimes after a how it works statement, depending on your solution. But in this case, I think it's important to establish that this is a major, major problem with a lot of people. It's a big TAM. Therefore, it's going to be a billion-dollar unicorn. The issue with this slide is not all of this here represents your TAM, SAM, SOM. I'm going to break it down. You've got nuggets in here, but we need to take a look at it. 6 billion smartphones. That is not your TAM. 6 billion smartphones does not represent the market whatsoever because not everybody who needs your product service, teenagers or young people, don't need it. So this is not going to move the needle. We need to get away from this right here. Now we're getting somewhere with 50 million dementia patients and Parkinson's and 2.8 multiple sclerosis patients. Now here's what I want you to consider. We need to talk about your TAM. Your TAM is the total addressable market. That is if everybody who could possibly use your app, bought your app, how much money would you make? Or how many people would need your app? On top of which, people who get this after the fact is not going to be helpful. Therefore, your TAM are the new cases that are going to hit every year because you want to get into early detection and prevention. So let's say you've got 10 million new cases of dementia, 10 million new cases of Parkinson's, and just for number's sake, you've got 2 million multiple sclerosis patients. You can say our total addressable market is the 22 million patients who get Parkinson's, dementia, and multiple sclerosis every year, or any type of neurological disease. You might want to even open it up if that's what your app can do. You can say something along the lines of 50 million people will get a neurological disease every year. That's your TAM. Now, what's your SAM? Your SAM might be something along the lines of individuals who use smartphones. So you want to calculate because your business model involves a smartphone. Now, does everybody in your TAM have a smartphone? I don't know. You may want to say, we're going to target the individuals as our SAM, the ones who use smartphones on a consistent basis, and that's going to be a subset of your TAM. So let's say you've got 22 million people, and the people who would be ideal for this, for your business model, maybe they're in the healthcare system somewhere, or maybe they're in countries where they can get access to this technology or go to a doctor or something like that. Let's cut that down. Let's say half, 11 million people, that is your SAM. Then finally, your SOM is the realistic number of the patients that you think you could reach. And you may have a business model or go-to-market strategy, and you may say, out of those 11 million people, we're going to focus on, let's say, the 5 million people who are part of this healthcare system, who are part of this network and can easily access this information, something along those lines. Let me explain this one more time. Your TAM, SAM, SOM is important because it makes you analyze the market from the ground up. 8 billion smartphones in the world is a top-down analysis, doesn't mean anything to the investor. They need to know that you've researched your numbers and you understand how big your potential market really is. So if you do the research and say how many new patients a year could use your app, not just for early detection, but for monitoring every year, because you're trying to catch it early. So that's your TAM. And then you break down, say our business model is best for people with smartphones in a certain area, maybe a certain geographic area where they can get treatment, something along those lines. And then you want to say, realistically, this is the market that we think we can access if we raise the money in a reasonable period of time, which is typically about 5 years. We think we can reach 5 million patients because we are going to use this go-to-market strategy, and it's realistic for us in terms of what we're able to do. That's a very rudimentary lesson on TAM, SAM, SOM, but it's so important that you think through the market and you can justify, because investors, especially these types of investors, are going to really need this information, and they need to know you as a founder, you're willing to do a TAM, SAM, SOM market analysis from the bottom up versus just quotes and figures from the top down. Now, what I did is I moved this solution slide to after the market because we're going to get into the how it works. Because at this moment in time, put yourself in the investor's shoes. The investor's going to say, all right, all these people have undiagnosed and treatable, easily prevented, saving us millions of dollars a year. You've got the app that does it. I'm convinced. Now we need to know how it works because you planted the seed of doubt and the seed of curiosity, which is really great, in their mind. They're going to want to know. Now, this part of the deck gets even more complicated and convoluted because you have even more slides explaining how your app works. So we need to consolidate it into as few slides as possible so that you don't wear the investor out and lose their interest. Let's take a look at this slide, what you got. So you got an app. It gives you real-time updates, actionable insights, nudges, and sharing. Those are just bullet points. Doesn't really explain much. Now we get to another point of how it works. It's high retention. There's continuous monitoring, simple UI, easy to use, real-time results, insights, digestible chunks. You just said a lot of this on the previous slide, so we need to consolidate. Now we keep going. There's more bullet points. Continuous data collection, agree with clinical scales. Data insights, you're repeating half of this information has already been inferred in the previous slides before. And then you got this next slide. We got this video of gaze points and all that stuff. And it's just confusing, but I get it in terms of what you're trying to do. You're trying to show the evidence that this actually works. Then we've got the intellectual property that it's patented, which is important to explain. And then you've got this cross-sectional study of eye tracking and another one here. And then you've got another one here, a survey. This is all how it works and providing evidence that it works, and then you get into your business models. So we need to go all the way back up here to this slide, the app. And I want you to try and break this down into just one how it works. In other words, give me the story. It could be something like step 1, the user downloads the app. Step 2, the app passively tracks your eye movements. Step 3, it sends data somewhere. There's an algorithm that crunches it. Step 4 is early warning. How does it work? And step 5, they go in and get treatment. That's as simple as it needs to be. You don't have to be redundant and explain it. You just need to show in a very simple narrative. Tell the story, all the magic moments of how it works. Boom, boom, boom. This is so simple because if it's too complex, the investor is going to start to question whether you can implement and all this stuff. The information gets jumbled in their minds. So make it super simple. Think of it from an Uber perspective. Think about the how it works slide for Uber. Before, you used to have to go and call a taxi cab and tell them the address and stand out there, or stand out in the road and hail a taxi and have them drive by. Now it's simple with Uber. I've got Uber right here on my phone. All you got to do is go in to this app, tell us where you want to go, and then the car's going to come pick you up, and it's going to tell you exactly how far away it is. And then after you're done the ride, you get charged, you pay, it's done. All the other mess is not there. See how simple Uber sounds? Even though it's a really complex product, that's the magic of it, because you're removing all the friction of what happened before. In the same situation, your app removes the friction of the entire medical process. Make it so simple. I dig the fact that it's passive. That to me was really fascinating. So consolidate all this together. Now I want you to keep the patents in, but I'm going to get you to put it into another section, and that's the traction. What I don't understand, and you're going to have to give me a better narrative. I don't understand what this means. This means nothing to me. In fact, I don't even think you need to put it. If you want to put in something like there are surveys and all those things and prove that now is the time, then you want to include that and say, all right, tracking of somebody's eyes has proven for early detection and prevention. This doesn't tell me that. I don't know what I'm looking at. I don't know what I'm looking at here. I don't know what I'm looking at here. You've got different pieces of information, but if you want to put a slide, just have one slide with all these studies in there and just make it bullet points. Proof that eye tracking works, and say, bullet one, these number of people were prevented from getting this. This study tracked eye fatigue, etc. And then you're good to go if you need to put this in. Because I do understand that you need to have medical proof that this solution is in fact possible, because I've established earlier, some people are going to think, like I started to think, you know what, can this really happen? But it's fascinating, because if it can, and it does work, wow, is this ever a game changer? Business model slide. What I want you to do is explain how you're going to make money. This is not a business model slide. You got business model here, but you basically have pharmaclinical trials. That's something that you've done. Patients track disease. That's a little better. Direct to consumer, direct disease. Are you going to charge monthly to it? Who's going to pay? Who will pay? There are so many different factors going into this, because getting someone to download an app, there's something called app fatigue, everyone. All right. So can you get it so that maybe this is integrated? There's a go-to-market strategy where it's integrated into an app that doctors' offices already use, or something along those lines. Who's going to pay? Am I going to pay? Do I really want to pay $5 a month to have my eyes monitored? You're tracking me. And is that enough for me to actually fork over some money for prevention? That's not an easy thing to do. So figure out the model. In other words, you need to answer how you make money and how you plan to make money. Put that in there and start to work these bullet points. These collaborations, you can put these in here in terms of you're going to be working with these partners. Okay, I get it. But we can start to incorporate also this information of your collaborations in another section of your deck. And I'm going to show you how. Now we get to the competitive landscape. This is interesting. In the beginning, I didn't like the slide, but then when I looked at it, I was like, that makes a lot of sense. I thought about recommending a magic quadrant, but you know what? I'm on the fence on this one. So I can't give you a real critique other than I start to warm up to this slide, because you clearly are showing how you're different right in here. I kind of dig it, and all the competitors over here. So I'm going to say I'm a 50-50 on this slide. I think it's clever, while at the same time, other investors may say, what is this? But this sentence here could be tweaked a little bit. Smartphone-based eye tracking provides a seamless, sensitive measure of cognitive health. That's your solution. You could say something such as, our app monitors screens for early detection and prevention, unlike our competitors that are all about diagnosis, treatment, and management. Say something in this sentence up here, and that might make this image a little more easier to process. Put a sentence up at the top and then have it explain this graph. The other thing here, make it smaller. Okay, just put it right here up top. You don't have to have your label of competitive landscape, the biggest font in the boldest. I'd rather have this main sentence here saying, like, we are different from our competitors because we focus on monitoring to prevention, whereas others focus on diagnosis to management. That needs to be the biggest headline there, and then you can explain this graphic. Here's your progress slide, which is another word for traction. You want to demonstrate what you've done already. And I like what you've got here. We can reorganize, because these graphics, they really don't mean anything. So you've got Q3 2023, you launched the MVP. Great. Q4 2023, you've got these participants doing it. I like this because it's showing growth, which is great. But I don't understand. Agreement with fatigue survey doesn't make a lot of sense. You want to explain. We've had 180 participants participate with our fatigue monitor. It needs to attach to the MVP. How many people are using the MVP? And then you got pilot study, exploratory outcome, new insights beyond self-reported surveys. I don't know what that means, so explain it. Now, here are the bullets that you could be adding. You could be adding the patents. When were the patents filed? And that is traction and progress. We've got patents, 2 that were awarded, and I believe you have 9 that were filed. And then you could have the collaborations, the collabs. So put in this slide, we have established collaborations with these companies, and put this all on one slide. You can get it together and explain these are the highlights of what we've accomplished, so that you're showing investors, all right, this is actually in existence and it's showing results, and we understand how to get to product market fit eventually, or we're getting the signs that we know how to get to product market fit. Here's your team slide. There's one issue. I don't know what these logos mean. Was your CTO the CTO of Stanford Medicine? Did your CTO just go to Stanford Medicine? Is she an instructor at Stanford Medicine? So we need some bullet points to explain all these logos. It's great if you want to put different logos to support what you're saying, but please be very clear about your bullet points so you don't leave anything up for interpretation, misinterpretation, or the accusation that you're embellishing the accolades and the domain expertise of your team. Same thing with your advisors. Let's get some bullet points in there. Fancy logos, but I don't know. Are you one of the partners, early investors at Amazon? What's going on here? So get some titles and bullet points to explain what your advisors do, to show the investors that you've attracted some high-powered advisors, which is another sign of traction. Here's the ask slide. Here's what I want you to do. I want you to put in a headline right here. We are asking for $250,000 to reach what milestone? So we are asking for $250K to reach what milestone by when? Maybe you want to say we're raising $250K to launch our program officially, to start generating revenue by whatever, end of 2024 or beginning of 2025, something along those lines. So just be very clear. Now you want to get rid of things like this. Post money valuation. That is not up to you to determine the valuation on your company. You're going to be negotiating that with the investor, because they can approach it in so many different ways. Maybe you want to say we're going to hire use of funds. Use of funds is important. That needs to be blown out. And then get rid of this 25K a month burn. How do you know? Nobody knows. You can say that you've got some projected expenses in terms of full-time employees. However, they want to look at your financials and figure out how you got to that 25K a month burn. You don't want to explain runway or anything like that. You just want to talk in milestones, and then leave the due diligence later once they start to get interested and they start asking for it. But don't put it in there and get them hung up on numbers you don't really understand fully. And then here, non-dilutive grant. Did you get the non-dilutive grant? Are you trying to apply to the non-dilutive grant? If you did get the non-dilutive grant, that needs to go on your traction slide. If you plan to apply for a non-dilutive grant, then put that into use of funds. So consolidate and just make it very clear with the headline up top what you're raising the money for, the different milestones, by when, and then make sure you take out the details that are going to get the investors hung up. And then you got your contact slide. This is super interesting because I didn't know that you could track eye movements for early detection of things like Parkinson's and dementia. Therefore, I was intrigued, and that's where you want to be. Novel insight for the investors. So I think you're definitely on the right track. And for the rest of you founders, you're watching this because Luke courageously submitted his deck and graciously allowed us to record this to share with everybody else. I appreciate it, Luke, and to your whole team and what you're doing. Keep going. If you're a founder out there and you want your pitch deck critiqued and reviewed, it's super simple. Leave a comment and I will hit you up and I'll tell you how to submit that deck. Other than that, I appreciate like, comment, subscribe to the YouTube social thing, and I will see you in the next video.